Just
14-month-old child, mother name is, let's say,
you ask no during the like introduction you can.
okay. Oh, yeah.
So this is a case of 14-month-old boy who had recurrent wheezing for last 2 months and visited 4 times to GP. The child was born premature at 27 weeks of gestation and was ventilated for a week and diagnosed as a case of chronic lung disease. So take a focus history of from this child.
Okay.
Dr. Jayaprakash, you keep the timer 9 minutes and 14 minutes. Okay.
Okay. Okay.
Okay. So we'll start. Huh?
Sure.
Mother name is Janika, and child name is
Samuel.
John or Samuel. What?
Yes. Samuel
Okay.
Adam. Hmm.
Fine. Fine. So hello. Good morning.
Good morning, doctor.
I'm Dr. Hiren, one of the children doctor here. I believe I'm talking to Jenica, mother of Samuel.
Yes, doctor, I am.
Uh, how are you, Miss Jenica?
Yes, doctor, I am fine, doctor. Thank you for asking.
You are most welcome. How Samuel doing?
Yes, doctor, actually, he has lots of problem for which I visited GP frequently, and he has asked me to see you for further advice.
Yes, Miss Jenica. So today I'm here to take ask you some question about Samuel problem, and meanwhile I will take some note. Would that be okay with you?
Yes, yes, sure, no problem.
Thanks, Ms. Janika. So I have gone through the referral letter from your GP that Samuel has uh, more cough in the past 2 to 3 months. So could you please tell me in little bit detail what is the reason why you are in clinic today?
Actually, doctor, 2 months back, he had some cold and there was mild fever. And after that, he started getting cough. And this cough was like he was coughing during day and night intermittently. And it remained. I visited GP that time, and he gave me some medications. And after that, it did not subside for 2 3 weeks, and gradually it subsided. However, a week later, again the cough started. Similarly with the cold again, and two such episodes happened further. So,
Okay,
like
and
after the third episode, he gave me some inhaler, like blue inhaler, for which I tried, but it was not also that much effective. So during this episode, 2 days back, he started the cough again, and
I
then
see.
he told me to visit pediatrician for further.
Mm-hmm. Mm-hmm. So, what was the kind of a cough Samuel was having?
Mhm.
Is it kind of a dry cough or
Mhm.
any phlegm was there in the cough?
Mhm. The doctor, it was more of dry type, and it was not like continuous cough. It used to come in bouts, and it used to subside for a few hours. Then it again used to come after a few hours, the bout type cough.
Okay. And is there any particular time where the cough more and anything, the time where the cough is least? Any
Yeah, cough.
variation you have noticed?
Yeah, cough. I noticed that it was more in the night, but it was not a great difference. You can say like little bit more in the night, but throughout the day also it was there.
Any factor did you notice which you feel probably increase his cough and anything which
Yeah,
decrease?
I noticed that this cough, that with activity, it increases more actually.
Okay. And after starting the medicine, you feel there is any difference?
Yeah, after blue inhaler, he gets temporary relief. For the time being, you can say 4 5 hours. Then it comes again, and it's same like bouts, and it takes like first episode it took around 2 3 weeks to subside. Again after with the blue inhaler also it took like little bit more time, like same around 2 to 3 weeks it took to subside.
Okay. Okay. And any fever along with the cough?
First episode there was some fever, but later on there was no fever as such. But there was cold. I feel in the every time the child got this cough.
Okay. I see. And uh, apart from this, how is he doing at present? At present, is he on any medicine currently?
Doctor told me to continue this blue inhaler till I see you, and I'm continuing that. Apart from that, there is no medication like he said. Some multivitamins are going on and iron is going on, but no other medications for this cough apart from the blue inhaler.
Okay. Okay. And uh, any specific test done during all this your visit with the GP?
No, doctor, no specific tests were done.
Was he admitted for this problem in the hospital?
No admission. For this problem, cough, no admission.
Okay. Was there any admission in the hospital before due to any other reason, any operation or any other particular condition?
No, doctor, he was not admitted for any operation, but he was admitted when he was born.
I see. For what reason? What happened to him when he was born?
He was born before date, 27 weeks he was born, and after
Mhm.
that he was kept in ICU for around, you can say around for 50 days he was in ICU.
I see. Mhm.
And he was given some breathing support machine. Uh, Breathing support
Okay.
was given, antibiotics were given, and some tube feeding was given. Lot many things were done that time. But
Okay.
after discharge,
Eh,
also he was put on some oxygen for 3 to 4 weeks, and after that he was okay.
Okay. All right. And any problem in the brain happened after this? Any fits happened during long stay in the neonatal ICU?
No, doctor, no fits were there.
Any infection, major infection episodes during that stay?
Infection I don't remember, but they give antibiotics for 7 days, and after that they stop the antibiotics.
Okay. At present, are you in consultation and follow up with any team?
We are going for regular growth checkup and developmental checkup for this as baby is premature, that we do regularly, and vaccination also we do regularly.
Okay, that's good. Okay, so uh, any other problem with the vision?
No, doctor, vision was checked after the birth, after discharge, and at 3 months also was checked and everything was okay.
Any problem with the hearing?
No, hearing was also checked, it was normal.
Any problem in the head?
Head,
Yes.
what problem you want to say?
Any related to like brain function?
I don't understand, but I don't see any abnormality there.
Any water in the head or like that? Nothing.
No.
Okay.
Nothing is okay,
Okay.
fit and fine otherwise.
Okay. And
9 months
any
finished.
any vomiting?
Vomiting, sometimes it is vomiting after feeding.
Okay.
Maybe
Any difficulty?
same.
Hmm. Any difficulty in pee?
No, no, no difficulty. No.
Difficulty in poo?
Food?
Poo.
Okay.
Defecation.
No, no, it's okay. It's regular. Like he passes once in a day, and this is okay. Yellow color.
Any skin rash?
You mean to say eczema type?
Yes.
Yeah, no, no eczema.
9 minutes
Okay.
finished.
Okay, okay.
Okay. Okay. Any does he have any allergy to any food particles, any milk, any allergy to any
Allergy
milk?
means what happens in the allergy, doctor?
Yeah, like sometime vomiting, rash, sometime coughing
Okay, okay, okay. No, no, I don't see any
after
particular
food.
problem after any food.
Anybody in the family smokes in
Yeah,
the home? You or your partner?
yeah, my partner smokes, but usually he smokes out of the house, not in the house.
Okay. Okay. I see. And how many siblings you Samuel has?
Yeah, Samuel, I have one elder child, 4 years old, and last 4 or 5 months he is going to school.
Hmm. Is he okay?
Yeah, he gets intermittent cold from the nursery. Otherwise, okay. There was no issues with him regarding anything.
Okay. And how is the growth of Samuel? His height and weight is growing well. Any concern regarding his growth?
He appears small as compared to his age, and I feel he's behind. But the growth doctor says like because of he born prematurely, he's okay. There is no concern regarding his growth.
Okay. And any cat or pet animals in the house?
No pets, doctor.
Mhm. Any frequent episodes of vomiting and discomfort after the feeding or
He
during feeding?
vomit small amount of food, and sometimes I feel that he had some discomfort, like he like cups after the vomiting, small
Okay.
bout.
How you are coping with this problem, Miss Janika?
Yeah, actually, doctor, initially it was very stressful when he was born. Later, he had oxygen at home, and now he's last 2 months. The problem is not getting solved. We are quite stressed, doctor.
I can understand it must be a difficult time for you, Miss Janika. And how do you think the Samuel is coping with this problem?
Mm, he doesn't understand much, but I feel he is suffering because of cough. He's not getting adequate sleep, and his routine activities. I feel he is like with that activity, it's getting worse. So he's not that active also.
See, okay. Okay. Any financial problem you have? Do you
No,
have any
doctor.
financial support?
My partner is chartered accountant, and we have insurance, so no family financial problem.
Okay. What is most worrying you, Miss Janika?
Doctor, this cough is so irritating and coming again and again. So I feel that this cough will affect his growth in future also, and this may be that birth problem might have damaged his lung. So I'm worried that his lung will get damaged permanently, or he may be having some asthma. I feel.
Anybody in the family have asthma?
No, nobody in the family, but I read on the internet, so I scared that my child might get asthma.
I can understand your worry, Mr. Nika. I will try to help you uh, after this consultation finish, and we'll do our best to help you in this situation.
Thank you, doctor. Thank you.
Jenica, is there anything which I didn't ask you and which you wanted to tell me about Samuel health concern?
Yeah, actually, doctor, GPA, like they advise me some extra jabs that they have to take some flu vaccines annually, and we have taken them.
Right,
I want to tell you.
right. So, did you give him the flu vaccine jabs and
Yeah, yeah, we
other
have
jabs
taken
like
got pneumonia and flu vaccine we have taken.
and the other vaccination, other vaccines also? Did you
14
give
minutes
on
done,
time?
almost 15
Okay.
minutes.
Oh,
Doctor,
okay. So nobody told. Fine. So let's.
Dr. Prakash.
I was waiting. Okay.
So, okay, present your case.
Okay. So today I took a history of a 14-month-old child, Samuel, um, who has come up with a complaint of a repeated cough, moreover a dry cough, and it comes in the bout and episodes, and with the background of premature delivery with the long stay in the neonatal ICU
Mhm.
and background of the chronic lung disease. So he was having a cough intermittent since past 2 months, and moreover it is a dry cough, and uh, relieved little bit after these salbutamol, and also received antibiotic before, and cough was like relieving in after a few days, and again it is coming recurring recurrently it is happening with Samuel, and there was no hospitalization for the cough per se, and also there were few episodes of vomiting, and there was no any sputum coming in the cough, and his growth comparing to the his birth history is slightly smaller for his age, and he has received all immunization, and there is no particular allergy to any substance or any food, and there is no family history of asthma, and he the mother is quite worried about the possibility of asthma and lung damage because of the cough,
So,
and
what are you
his
thinking
brother,
now?
yeah. So considering a chronic lung disease background, uh, I would like to keep on the first on the top is probability of the bronchiolitis, as most of the time he was having uh, cough associated with the cold. Second is possibility of the pertussoid type of cough, and also third is the viral kind of illness which gives wheezing, as his brother is going to the school, and he was also having few episode of the golden cough, and the other possibilities like a food allergy or milk protein allergy are also there, but there is as such there is no history. Mother has not noticed,
Okay.
and also there were few vomiting, so it could be gastroesophageal reflux disorder also can produce the such type of cough.
Okay. You
It's
said
like
bronchiolitis. You said
yes.
bronchiolitis as your first diagnosis. So, do you think bronchiolitis lasts for 2 to 3 weeks cough?
Usually no, but initially it started. Let's say he started since 2 months, so maybe he had first bronchiolitis episode, then residual cough,
Mhm.
or he is getting every time new
Mm-hmm.
upper respiratory tract infection,
Okay.
and because of the chronic lung disease,
Mm-hmm.
he might getting a frequent
Mm.
bouts of cough.
Okay. Is there any possibility of asthma disease?
Is early, but early for the asthma, but yes, there can be. It cannot be ruled out because it's very difficult to check the peak expiratory flow at this age.
Mm-hmm. So, what are the negative factors in the history that you can say that they are not favoring in the asthma?
Not fearing asthma, negative factors are like there is no family history, and even though he's on salbutamol, there is not a remarkable relief, as the mother said. She said there is only limited, mild improvement, but there's not much difference after salbutamol inhaler.
Mm-hmm.
And age is also not suitable for that.
Okay. Okay. So, what advice you will give to the mother?
So I will reassure the mother, and I will explain that these are the possibilities, and will continue observing Samuel, and will also explain the mother like the elder brother is going to the school, probably he might be uh, getting the viral infection, so try to keep isolate whenever he is sick,
Mm-hmm.
as well as uh, I will
So,
advise
what
mother
investigation
to
you would
give
like
the
to do here?
warnings.
What
Sorry.
investigation you would like to do here?
Yeah, here I would like to do the X-ray chest,
Okay.
and if the vomiting is very frequently and severely happening, also I would like to do the uh, probe pH study to rule out the reflux.
Mm-hmm.
And I would like to do the general routine investigation like complete blood count and inflammatory markers like CRP to assess the severity of the infection or to possibility of any bacterial
So,
infection, which is quite unlikely.
what will be the management in this case?
Yeah, so in this case, we need to control the fever. If there is a fever, I would just like to prefer to give symptomatic management, like for the fever and a cold, and for the cough, I would reassure the mother to. Uh, I would advise her to give the Ventolin inhaler after like ruling out the other possibilities before starting the antibiotic, like by reviewing the complete blood count and the X-ray. If there is no pneumonia and then even the inflammatory markers are normal, I would like to
So,
give the
any role of
symptomatic.
montelukast or inhaled steroids here?
Inhaled steroids, yes, it helps, but it is a short duration, and most likely in this particular case, because looks like because of the recurrent viral uh, illness, so
Mhm.
unlikely it is helpful, but I would like to discuss this before I start with my consultant
Okay.
whether it can be helpful
Chalo.
for Samuel.
I'm finished. Thank you.
And I will just advise the mother to I try to.
Okay.
All right, thank you.